All right. Good morning, everyone. I think we'll go ahead and get started. My name is Dr. Chris Kevel. I'm the Vice Chancellor for Research here at LSU Health Sciences in Shreveport. I want to welcome everyone here today and to thank all of our faculty and staff who've worked tirelessly over literally the past 18 months to help address this pandemic. I also want to thank all the members of the media for being here today and for all of your efforts to keep the community informed in this pandemic. We really have had a really good relationship to make sure the important information gets out. And I'm asking respectfully that we hold questions until the end because we have all of our speakers that have information they'd like to share with you. As the only academic medical center in Louisiana north of New Orleans, LSU Health Shreveport recognized the inception of the pandemic that would bear a tremendous burden on the community. As such, we had a responsibility and privilege to position our community as favorably as possible to address this pandemic. As we're seeing today in the start of the 2021 Olympics, even with the best preparation, goals and dreams are sidelined by this pandemic, as evidenced by the number of premier athletes who will not be competing due to testing positive for COVID. The reason we scheduled this conference today is to impress upon our community that now is the time to take action and to avoid our beloved community from being sidelined based on the rise of COVID in the community. As physicians and scientists, we have devoted our education and careers to studying viruses as well as infectious diseases, and we want to make sure that our community knows that we have a vaccine that really can do a good job, and that we got this vaccine here in the community as quickly as we could, and have even enrolled children in clinical trials so that we can make sure the vaccines are safe and roll them out. With cases on the rise and vaccines remaining low, we know that without a change in course, we could soon be returning to the former restrictions and, more importantly, and more sadly, losing more lives. Therefore, in the spirit that we are all in this together, we want to provide the most up-to-date information on the Delta variant, safety of the vaccine, and the importance of continuing to work together to overcome this pandemic. Addressing you next will be Dr. John Vancheri, who's the director of our Community Outreach Testing and Vaccinations for the Center for Emerging Viral Threats and the principal investigator for the Pfizer vaccine clinical trial.
Great, thank you, Dr. Kevel. As Dr. Kevel pointed out, we are, as a nation and society and a world right now in a pandemic, going in the wrong direction. And this virus doesn't have a will of its own. Its course is not predetermined. The important news is that only we can change the course of this pandemic. And the most important part of changing the course of this pandemic is getting vaccinated. Our vaccines are safe and effective. Despite the myths that are promulgated in some of the social media, our vaccines do not impact fertility. Our vaccines don't have magnets in them or chips in them that are tracking you, and they are safe for all people to get vaccinated. We saw early this year our older adult population, the greatest generation, come out in force to get vaccinated because they recognize the risk to themselves and to our community. Our vaccines have been saving lives every day. Every day. Already, 600,000 people in the United States have died of COVID. Over 400 of those are children. And we know every year that about 200 children in the United States die of influenza. So we're already at twice the number of deaths due to COVID as we typically see due to influenza in children. And it's increasing every day. I'm seeing more children in the hospital with COVID and complications of COVID. We're seeing more adults in the hospital with complications of COVID. And the only way to change the course of this pandemic is to get vaccinated. And when we talk about the Delta variant, and so just in basic terms, what are variants? And I always like to get it really basic. The original strain of the virus that circulated 18 months ago we're going to call vanilla ice cream. And the variants are simply vanilla ice cream with a cherry on top, vanilla ice cream with pecan sprinkles, vanilla ice cream with Jimmy's, or whatever you put on your ice cream. Each of those is a variant compared to the original strain. And each of those variants, as they manifest, is an opportunity for the virus to try its own tricks at subverting what we do, how we know we can change the course of the pandemic. And it's that continuous testing of mutations by the virus that we cannot control. But we can control our own course in this pandemic by getting vaccinated. When we vaccinate, we reduce the amount of virus replication in individuals who are infected. We reduce the amount of spread of virus in our community, and we very, very clearly save lives. So just a couple of final points. We know that now the number of cases has increased dramatically in Louisiana and in our area over the past 3 weeks. We're seeing it, we're being seen nationally. Over 80% of the virus that we're detecting is the Delta variant. The Delta variant is more than 50% more transmissible than the Alpha variant, which was more than 50% transmissible than the original virus. So what we're seeing is a progression of the virus accumulating mutations that ultimately allow it to be more successful in propagating itself and spreading from person to person. And so changing that is incredibly important. And as Dr. Kevel said earlier, none of us want to have to wear masks. It's just not fun. None of us want to have to go back to lockdowns. The only way we can change that from happening again is to get vaccinated. We're still sitting at 30% of our population in North Louisiana has gotten vaccinated. That means 2/3 have not. That means 2 out of 3 people you see in the grocery store are not vaccinated. That means we have a lot of risk in our community, and that means more people will die in this pandemic. We may be finishing the second quarter of a long football game. We might be halfway through this pandemic. I hope we are past that, but I don't think we are. And in the spirit of this conference, I think the important message is that we are all in this together. We are seeing more people come out on a daily basis to get vaccinated at our site and at sites around the Shreveport and Northwest Louisiana area. We are vaccinating 2.5 times as many people on a daily basis this week compared to a month ago. And the vast majority of those are first doses. So the messages are very simple. Get vaccinated. If you've gotten your first dose, make sure you get your second dose. If you're not well, if you're feeling sick with a respiratory infection, get tested. Testing is widely available in most physician offices, urgent cares. Our site is open every day from 10 to 6. And so we want to encourage more testing because the testing helps us understand what types of variants and viruses are circulating in our community. It helps us know where they're circulating by your zip code, not anything other nefarious. And that helps us know where to target our interventions, our approaches. We're setting up, and we have been over the past 4 months, setting up 30 to 40 vaccination sites per month in all of around Northwest Louisiana, at schools, at businesses, throughout the area. And we are continuing to accelerate that, to get more vaccine opportunities out in the community. But we need people to come and take advantage of them so we can change the course of this pandemic. It's really up to us as a community to fight this battle locally. It's where we're going to win the battle locally. It's how we're going to save lives. So don't hesitate any longer. It's time to get vaccinated. I will pass the torch to Dr. White to say a few words, particularly about the statistics and what's happening in our region of the state and in the state with respect to new cases each day. So thank you, Dr. White, for your leadership, your partnership with us. It has been instrumental to any success we have. And as you and we are all committed, we're going to get through this pandemic. It's just a matter of what shape we're going to get through it in. So, thank you, Dr. White.
Thank you, Dr. Vancheri. Dr. Vancheri, when I first started having an outbreak in one of my nursing homes, where about 50% of the population was ill and dying, I said to him, we need people on the ground, people there, and he said, well, let's go. So we've been working together on this pandemic ever since, and he and his team and Dr. Kevel and his team have been a huge partner with us, so we're very grateful in return. So, right now, I'm very concerned and I'm very disheartened. I'm concerned because since July 5th, where our numbers for the entire state of new cases were around 200, the number of people in the hospital was around 40. That's on July 5th. We have steadily gone up. I was concerned in talking with these partners when we were at 400 and then 700. Then we went to 1,200. And then you all saw we went to 5,300. We're at about 2,500 yesterday, and I haven't seen the numbers released yet today. But we are climbing rapidly. We have 97 people in the hospital today in our region. We have 900 in the hospital in the state. We were down to about 30 or 40 in the hospital at one point, where we were at the point where we were just seeing sporadic cases. We weren't seeing outbreaks. And so this rapid rise, these clusters of cases, these young people hospitalized, is very concerning. The disheartening aspect of it is, first, we know what to do, right? We faced these surges 3 times before. Those times we didn't have a vaccine. So first off, we need to get vaccinated. People need to put what's best for this community, for this state, and even for this country, above what's best for themselves. This is, like Dr. Vancheri just spent a long time talking about the safety. They're very safe vaccines. I had someone say, it's a risk-benefit analysis, Dr. White. That's why I'm not taking the vaccine. Well, no one's died from this vaccine. Not in this state, no one has died from this vaccine. And we've had 610,000 people in this country die from the virus. Analyze that. That is a huge number of people who are dying versus 0 dying from this vaccine. People are scared because they're hearing these rumors. There was a female that stood up in the city council. She stood up in the commission. She has said hundreds of thousands of people are dying from this vaccine and we're hiding it. So when we had 6 people have blood clots from Johnson & Johnson, we put an immediate hold on that vaccine. Do you not think that this country would put a hold on the use of a vaccine if people were dying? There are no people dying from this vaccine, but people are dying from this virus. And this virus is changing. This Delta variant is a higher risk for all of us. We know that people who are vaccinated can carry it in their nose at a level that will allow them to spread it to other people. We also know that people are getting sicker and quicker with the Delta variant. So young people, healthy people, and we all need to take notice of that, because my counterparts who are actively working in the hospital are seeing their friends now in the hospital. It's not people my husband's age in his 50s, it's people in their 20s, 30s, and 40s. We need to take this seriously. It's so simple. If you don't want to get a vaccine, wear your mask. It's a piece of cloth across your face. No one is asking you to sacrifice your rights, but to start considering the people around you. I do fear what we're going to see. If we don't start paying attention to what we're seeing right now, we are in a rapid climb, and we're going to see more people. Next, what comes is more deaths. So we've seen more people sick, then we saw more people hospitalized, then we're going to see more deaths in young people. So please consider getting vaccinated if you're not going to get vaccinated, because there are some people who just are not going to get vaccinated. If you're not going to get vaccinated, then wear your mask if you're going to be out. It's not if you're at home, it's not if you're outside, it's when you're around people where you could get sick or where you could spread the virus if you are not wearing your mask. I just got grilled on Keel this morning about masks don't work. There's all these studies that show masks don't work. Me wearing my mask alone is not going to protect me completely. What, about 60%? It will protect me. You wearing your mask raises that, about 80%. We add the distance, now we're adding up into the 90 percentile of safety for the two of us. That's how masks work. We can all subvert, pervert the knowledge that's out there to make it so that we can say, this is why I shouldn't have to do this. The simple truth is, you should do it because it's what's right. It's what's right. If we're going to get through this pandemic without people suffering, without closures of businesses, without people dying, then we need to do what's right. Thank you.
Thank you, Dr. White. And as I think we've all heard from both Dr. White and Dr. Vancheri, this really is not only a medical emergency, but also a community emergency. And so with that, we'll turn to our representatives from the community to say a few words. And so I'd like to call up Pastor Roosevelt Seabury. Please, sir.
Let me begin by thanking Dr. Kevel and Dr. Vancheri and Dr. White, who are doing an exceptional job to get the information out to the community concerning this assault and attack upon the citizenry of Shreveport and surrounding areas. So thank you for all that you do to help us to get prepared. In 2001, I was hired as the first African-American director of pastoral care at the former LSU hospital, now Ochsner, on the other side. I served as the lead chaplain, the head chaplain for 15 years in the hospital. I was a part of the trauma team, working closely with the doctors, seeing the hurts and the pains of the nurses as they cared for the patients. I was by the bedside and I prayed with patients who were very sick, and that oftentimes in critical situations they were put on a ventilator. And many of those days, praying for patients and praying for the nursing staff and the doctors who are giving everything that they have, I've also had to comfort the family of those who've died, lost their loved ones because of them not being able to survive from the ventilator. And because of that, for this reason, this is personal for me. It's important that we understand that COVID-19 and the Delta variants and all of the other variances that are coming our way have to be addressed. So, in particular, not just in the city as a whole, but in particular in the Black community. On last Sunday, Dr. White and Dr. Venturi came over to the church where I pastor, the Union Springs Baptist Church, 702 West 71st Street, that I call the west side of Cedar Grove. One of the poorest neighborhoods, one of the poorest black communities, hard hit in every economical status. But they came to sit down and answer the hard questions. There are legitimate reasons why you see a lot of hesitancy within the black community at large. There's a lot of distrust. There's a lot of issues that we certainly have to take seriously in terms of being able to help them to understand that this information that's being given right now is real. Some of the things that's being said is that there's mistrust of the government and the healthcare providers. They use the Tuskegee study, they use the Henrietta Lacks case, they use history and a lot of other things where black Americans and black people have been mistreated or misinformed or not necessarily respected. And so Dr. Venturi and Dr. White took the time to listen to their concerns, to listen and to do what they could to answer every one of their concerns. And so I'm getting calls from Dallas and from New Orleans, from people who were on Facebook and listening as they were sharing for over an hour. And I appreciate you for doing that. I appreciate you for caring so much to where you understand that it is our community that's really being hit really hard. The black community have fears, and it's being said because of misinformation. They fear that it's misinformation or the advocates that are sharing information don't serve from their communities. And it's not that people have an irrational fear of new medical technology. It's that they have an awareness of a long history of being mistreated, deceived, and disrespected. And so I'm here today just to do what I can to say to our community in particular, the black community in particular, that I've worked in the LSU health science system, from the hospital side, even to the medical school side, and I've seen the researchers, and I know the people here have a heart for really trying to make sure that we're safe and that the information that's being given from this institution, you can take it to the bank. I know that blacks have issues with government sharing any type of governmental oversight as it relates to their lives. They feel like it's not equal access to vaccines in some cases. And that's because, there have been health disparities. There have been some barriers to getting to the places where we need to get the access to getting what we need. Many people believe that the vaccine, as Dr. Venturi has said, is designed to change them on the inside. They're afraid that DNA is being damaged or that genes are being changed. Those are some of the myths. Those are some of the things that's causing people to have the hesitancy. That there are microchips that's placed so that they can be targeted at wherever they go, monitored. Another thing that's being said is that the vaccine just hasn't been out there long enough for people to feel like they can trust it. And so with all that being said and all those things, there are those who know people or they're hearing about people who have lingering effects as coughing and throat ribs, kidney hurting, headaches, and drowsiness. All type of information and misinformation and disinformation is being put out in the atmosphere. And I wanted to come today to say that the information that you're getting, whether you are in Moortown, Ingleside, Cross Lake, Risa, Queensboro, Stoner Hill, Highland area, wherever there is a black community, just know that from the top of this process that there are black people who are involved in the process, black researchers who are involved in the process. And it is important for you to put your life in the hands of people who care so that you don't lose your life for fear. I'm going to share as I close. We already know that as of July 19, 2021, the CDC reported that 58% of people had received at least one dose of vaccine. And among that group, 59% of that group were white Americans, or white Americans, and 16% was Hispanic, and only 9% were black or African Americans. So, as I said, I'm here to do what I can to change the narrative. And so I have some suggestions as I get ready to close. And many of you know, if you ever hear a preacher say he's getting ready to close, in the white church, that's about 15 more minutes. But in the black church, that's another 40 minutes as we're getting ready to close. And before I give you the suggestions of what I believe is going to help our community, let me just, since I mentioned that this is vital to me, let me challenge our white evangelists, white evangelicals, pastors, Southern Baptist pastors, who are doing either going along with the misinformation because of fear of their congregations, or who are sitting on the sideline and acting like, I'm not supposed to be a part of that, I just stick to the gospel. Our motto at our church is that we are a people reaching out with the love of God, ministering to the whole man. The whole man. You just can't take care of a person's soul and not be concerned about the person themselves. And so I want to challenge our white evangelical brothers to do what they can to push their congregations to invite Dr. White and Dr. Venturi to come and sit down and answer the questions so that their people can be okay with the information. Here's what I believe will help our community. This is a serious issue. This is a serious variance. And so I think you have to, you have to think outside the box in order to reach the community that's being hit the hardest. So I say let's get radical to save black lives. Since black lives matter, let's get radical to save them. One, we have to find and recruit the gatekeepers of every black and brown community. They're real community leaders. Not the so-called ones, but the real ones that's living in the community. Neighborhood watch presidents, civic leaders, activists, teachers, city council persons, parish commissioners, and Acts pastors, and SPOR. I don't know if it's called SPOR anymore, Shreveport Parks and Recreation, to provide their facilities on a specific day to get everyone out to get vaccinated, opening up the centers if necessary. Because in every community, there is a center. On a specific day, let's do that to get all of them opened at one time to give every neighborhood an opportunity. The second thing, request funding from the governor, the mayor, the city council, the parish commissioners, the business community for money to provide food, chairs, transportation, music, door prizes, giveaways, and support staff if necessary to accommodate those who live within the community and to help facilitate and participate in saving the lives of those they know and love in their community through giving vaccinations. Let's make it like a get out to vote. As they do when you're trying to get folks to vote, let's push it to get people out to get vaccinated. And finally, I told y'all, I'm closing now, I'm finishing. Have pastors in each neighborhood to come out publicly supporting Dr. Vancheri and Dr. Martha White. Then each pastor invite them to come and speak to their churches to dispel the disinformation and the misinformation that is causing vaccination hesitancy within the Black and brown community, and to use their church facilities as a safe haven for their members and neighbors who live near the church to come and get their vaccination. It's going to take a massive effort where everybody's involved, and we're going to have to push it as if it literally is life and death, and we can do that because it really is. Thank you.
Thank you, Pastor Seabury. Next up is Mayor Perkins, who will say a few words. Mayor?
Morning, everybody. I want to thank our media partners for being here, for allowing us to put out such critical messaging this morning out to the community. I want to thank our healthcare leadership as well for the role that they've played over the last year and a half. I'm a military man. I'm a veteran of the United States Army, and I do not use military analogies very often. But I will say over the last year and a half, I have been in the foxhole alongside them and our faith leaders in this community fighting this virus. And watching their courage, watching their bravery, watching their hard work, their courage to speak truth to power, their courage to put out messaging when it was not very popular, makes me very, very proud, and I'm thankful to be standing shoulder to shoulder with each and every one of you. Pastor Seabury talked about where his church is located here in Shreveport on the west side of Cedar Grove. And the house I was born in is actually 2 blocks away from that church, one of the poorest neighborhoods here in Shreveport. And I stand here today as the mayor of this city. Gone off, fought for this country. I've gone to some of the best schools in this country. And I've truly been blessed and been able to live the American dream because of the values that I've gotten from this community, because of how much this community poured into me. And it pains me each and every day to see our community hurting. And that's where we are right now. We are in a very bad spot. The spike in COVID-19 cases is extremely alarming, and it requires immediate action from all of us. This is the biggest public safety threat of all of our lifetimes. So as of today, as the mayor of the city of Shreveport, I am issuing a mask advisory. I'm encouraging each and every citizen, when you are indoors, aside from being in your home, aside from being alongside your family, to wear a mask. We do not know the vaccination status of those around you, as was pointed out. Probability-wise, 2 out of 3 people you see in a grocery store or you sit alongside at a restaurant is not vaccinated at this time. So please, please wear a mask. Over the last year and a half has been something very consistent in my messaging and our actions from the city of Shreveport, and that is that I have listened to the healthcare experts, and right now they are warning us that this highly transmissible and aggressive Delta variant is posing a huge threat to all of the citizens in our community. So we must act. COVID-19 has already not only given us this huge public health crisis, but has also devastated our economy. We cannot afford to lose one more person, and we cannot afford to go into another shutdown. Asking our neighbors and our friends, our family, to just wear a mask is very sensible, and it's effective, and it's a way that we can truly save lives. COVID-19 created both the public health crisis and an economic crisis, as pointed out. However, we did not stand alone in making those tough decisions. We had mothers and fathers who also had some hard choices to make throughout the pandemic for their families, while many business owners in our city were forced to close their doors for good. And we're finally starting to see some progress. We're finally starting to experience some progress. So as I close, and just so you know, I'm not a pastor. You don't have to worry about that. As I close, I don't want to just give this doom and gloom talk right now to the citizens of Shreveport. I want to provide some hope. I'm not a pastor, but I am a man of faith, and I believe that God gives us science. God gives us tools so that we can look after one another. And right now, we have vaccines and we have masks. And our public health leaders, even our political leaders in this moment, are telling us to use those tools. So we can take back control of our lives. We can make sure our businesses remain open. We can make sure that we're on a faster path to returning to normalcy. We can take control of our city's fate if we simply get vaccinated and we wear a mask. I'm asking each and every one of you to do that. Thank you.
Thank you, Mayor Perkins, for both your leadership and your commitment to this effort. It truly does take a team effort to deal with this. So lastly, I'd like to introduce our last speaker is Ms. Jessica Hemingway from the Bossier Chamber of Commerce, and we're delighted to have her up here. Jessica.
Thank you. I just want to stand here and say, while we do have concerns about this surge and how hard this pandemic has been on everyone, particularly our small businesses, many of them cannot handle another limit on patrons, and I'm sure are not looking forward to any sort of shutdown. They are so excited to be open and running again. So these businesses have worked hard to remain open and be sources of income, not only for themselves, obviously, but for the community, and to provide services and goods for all of us. First and foremost, my job is to promote the businesses. So I would say, as many businesses decide, perhaps even without a mandate, to ask you to wear a mask, to sanitize when you walk in or out of their business, or perhaps at a point of purchase, and to maintain social distancing, that you do respect those businesses as they are looking to protect their employees as well as you, the consumer. That is also, please, if you are sick, do stay home and do not frequent these businesses. Many have curbside pickup. We have expanded so many ways to get goods and services here. I mean, it's amazing how many things you can pick up with very little contact for others. So if you are feeling sick, those are very viable options for you as well. One of our hardest hit industries obviously has been our hospitality industry. And as we've been opening back up, we've all been enjoying events, and we hope to continue to do so. Our tourism partners have shared with us, though, that Adam Sachs, the president of Tourism Economics, has been doing research, and not that surprisingly, visitors are less likely to come to areas that have lower vaccination rates, which is here, unfortunately, here in our area. So in an effort to be respectful of our businesses, again, I just want to reiterate, it may not be your favorite thing to do, but if you're going into a business and they are asking you to wear a mask or take any other mitigation efforts, please think about the business owner and the employees there, and just be respectful of them while you're frequenting their business. And just on a last note, we do want to applaud the work of LSU Health Shreveport in our community. We have actually honored them numerous times for the work that they've been doing. They always do, but obviously during the pandemic, they've really stepped up with not only vaccinations, but testing. I mean, amazing amounts of testing. So we just want to thank them for their work. And again, just remember your business owners as your friends who you see out and about, and help them to provide goods and services in our community without hopefully having to close doors again. Thank you.
Thank you so much, Ms. Hemingway. In fact, she's absolutely correct. The Bossier Chamber has been fantastic. It's been a wonderful partnership to work both with the city of Bossier as well as the city of Shreveport. And we definitely want to do these right things and these recommendations to help preserve our businesses, preserve the health of the community, and get through this next surge. So I'm going to stop talking, and I'm going to open up the floor for questions so that we've got a panel of distinguished experts here. Certainly love to give everybody an opportunity to ask. Yes, sir.
I'm Dr. Boris, and thank you for the opportunity to hear. But I guess I'm a little disappointed because we got an elephant in the room, and nobody has mentioned the elephant in the room. Louisiana is practically, we're last, fifth or whatever we're last. And the elephant in the room, we don't talk about it. So are we complicit? There's a lot of good suggestions, and I appreciate them. And I'm working closely with, Dr. White and Dr. Van Cherry. In fact, we've got an event coming up on the 31st if the next still allows us to. But when you got the President of the United States for over a year talk about the hoax, talk about the vaccine, talk about the, that you shouldn't do anything about it. You've got the Republican delegation saying the same thing. I mean, what are you communicating to the public? And even now, we don't have an avalanche of support from, let's say, the Republicans, for example, saying, hey, look, Scalia's just this week got his vaccination. But is he supporting? And, we're a red state. But, we've got to stand forth and we've got to say, look, a lot of this distrust came from the White House. And it's, when you repeat it for a year, what do you expect? And so anyway, I just think I would have liked to have heard something about the elephant in the room.
Please, Pastor Seabear.
That's the reason. That's the reason that I make the appeal to the white evangelical pastors, because they're the ones who, for the most part, supported the Republican Party and the decisions that they made over the course of the last few years. And so they're still being told from the previous president to not necessarily receive this, to not follow the guidelines that are being pushed by President Biden, which is really ironic since President Trump was the one who pushed the vaccine and brought it into fruition, if you will. But it is the churches who have the opportunity to push that message to the congregants who are, because they're not going to get it from the Republican leaders. But you have to deal with at least the gatekeepers on the ground who are still pushing that type of a mandate. And so you're right. You have to deal with it, and the reality is that this variant and this disease is affecting everybody. It goes across party lines, racial lines. Everybody's affected. And so that's why I asked the churches and the pastors from the pulpit to change the narrative, to begin to push it and say, we're not even going to have a congregation if we don't do something to address what we're facing, this threat that's facing us now. So I hope that helps.
So, yes, Mayor Perkins.
Yeah, as the elected official on stage, I will say that the reason why I mentioned in my speech that now we have support from our political leaders is because Representative Scalise did fly home, he did get vaccinated publicly, they did give a talk about encouraging American citizens to get vaccinated. So now in this moment, we have bipartisan support. This now should not be a political issue, and we should see that support trickle down from Washington, D.C. in the same way we saw the divisiveness early on. But this is what's important to me. We can't change what happened a year ago. We cannot go back. We have a new president. We have a new posture from the Republican Party. And what we have to do is not point fingers in this moment. We have to get through this fourth surge. And then in retrospect, when we're out of this pandemic, historians and people can do all the finger pointing and say what happened here, here, here. My primary objective is to save lives in this community. And that should be all of our objectives.
So if we have somebody at the table now and they weren't at the table a year ago, let's just welcome them in.
But I don't feel like I'm pointing fingers, because I'm talking about today, the support is so lame, it's so, so I'm not pointing fingers.
No, you're very passionate about this. A lot of people are. We have had a lot of loss. A lot of people were criticizing, political parties for what they've done. But I just got to say, again, my emphasis is to say, hey, good on you, Representative Scalise, for getting vaccinated publicly. Good on you for GOP leadership for having a public talk, encouraging American citizens. And I'm hoping that I see the same thing from state leadership, GOP leadership, local GOP leadership. And honestly, our local, my city council members have been doing a good job at encouraging people to get vaccinated. So I'm saying I hope that trickles down, and we need to be looking forward and trying to bring them in, rather than even pointing out the way that they were last month, 2 months ago. That's my approach.
Hey, Doc, thank you for the question. Seriously, I feel like right now we need to meet people where they are. And that's one of the reasons why Dr. Van Cherry and the mayor and I met with the Ministerial Alliance. That's why we went and spoke with Pastor Seabury's church, and we're willing to speak with anybody. In fact, I haven't even told Dr. Van Cherry, but we have a very large, actually, primarily Caucasian church has asked us to come and do the same. So that's exciting to me that we're having people reach out to us. But we have to reach people where they are. And so many people have so many different reasons, and that is one of them for sure. We have to address it as we speak to different groups. But the goal has to be right now safety, and that's safety, either get your vaccine, let us come talk to you about it, and wear your mask, period. That's what we have to get the word out. So I think you're right. We have to address all groups, and each group has a variety of different causes as to why they have not stepped up and gotten vaccinated. I think on all sides we're seeing people reach out, which is exciting. I will tell you, the angst, the anger, the aggression towards people who are speaking these words has gotten out of hand. When I stand in front of a city council meeting and I'm literally cussed at because I'm bringing science facts and it's not what someone wants to hear, that's not an intelligent conversation. I'm happy to talk to anyone about their concerns, but we have to understand your rights are your rights until they harm someone else. And that's where I am on this. I try not to be political when I speak to people. I try to tell them just the science and why it's so important. So I hope that we can start finding those, the mayor has really encouraged us to find more ways to reach out to people, than we have already. And we're gonna keep pushing. But we need your help. We need you to talk to your friends, to your church, to your family. If someone is telling you, I'm not getting vaccinated, talk to them. say why, address it with them, because you're more likely to affect them than I am. And I agree with the pastor about finding leaders in the communities, and I think he's helping us work on that.
Thank you. Yes, Ms. Fair.
Actually, I have a couple of questions for Dr. White, so just go to the microphone for a second. Where are there any specific hot spots or places that you're specifically concerned about right now as far as COVID cases?
So all of my non-parishes are above 5% positivity. We've all gone from 2 to 5 to 9. Some of them are 8. I think Shreveport's 6.8, I think, the last percent positive. So all of our parishes around here are seeing climbs. We have had little outbreaks here and there, but what we know is people aren't getting tested, and that's so important. Mm-hmm. If you feel like you're having allergies, if I have allergies every day, and my allergies all of a sudden are knocking me over, like I'm feeling terrible, go get tested. If you've been a contact to someone who's sick, go get tested. Don't use the I don't want to be a case and have to quarantine as a reason, because we need to know where these cases are so that we can help combat it in our community.
And to follow up briefly from Dr. White, the EVT efforts, the CEVT efforts at the old Chevyland, testing is available every day at the same time vaccinations. You can get the molecular test, the regular PCR test, as well as the rapid test. So she's absolutely correct. They're there all the time, open. Just drive on up and get the test if you want it. Or if you hadn't had the vaccine, definitely get the vaccine there as well.
Just for comparison's sake, at the height of the pandemic, when it was really bad, and I realized from what Dr. Vancheri says we're headed that way now, what was the percentage rate then for testing? Like at the height of the pandemic, right now it's 5, what was it then?
I can't remember the exact, do you remember, Dr. Vancheri?
I think we got to 8, 10, 12%, sort of in that range.
Okay, so we're headed that
So
way.
We're seeing that in some local hotspots now.
We had some spots where it would be 20
Right.
for a few weeks, and then it would drop back down. As far as cases, you know that case load yesterday was the 3rd highest in the state ever. Mm-hmm. So since we started all of this. Mm-hmm. Sure.
So one reason that I have heard that people are not wanting to get the vaccine is because they say, well, there's only it's only been authorized. It's not FDA approved yet. Can you tell me if there's any idea when we might see FDA approval and why it's still okay?
Sure.
Even though it's just been authorized.
Sure. So the question is, what's the difference between emergency use authorization and full approval by the FDA, and when is it expected that will happen, sort of progression from emergency use? So the emergency use authorization is an action that the FDA can take in an emergency, and a pandemic is a good example, when we need a critical tool in our toolbox, be it a vaccine, a medication, and the like. And so that emergency use authorization prioritizes safety over knowledge about effectiveness. Okay, so let me dissect that. When we're doing a clinical trial, we're always focused on those two things. Is it safe and is it effective, right? And so the effectiveness part of it, that is, does it prevent death or prevent illness, takes a longer time to understand, to get the data that is conclusive, than does the safety aspect, right? We can tell very quickly if it's safe. And so the clinical trials that were done with the Pfizer and Moderna vaccine each enrolled over 45,000 people worldwide. So that gave us a very large population of people who had received vaccine or placebo, because it was blinded, and very quickly we could understand, are there any safety issues related to these vaccines? And the answer was no. Yes, that was short term. The FDA required that we have safety data for at least 2 months after the second dose, but ongoing, of course, we constantly reevaluate that data. So now we are a year out from the first doses of the Pfizer vaccine in people's arms. So we're continuing to accumulate that data. So the emergency use authorization was based on Do we have a vaccine that's safe? And will we soon, and we now know, but will we soon have data on its effectiveness? And the answer is yes. When we go for full authorization, it requires both of those things to be, fully available. And so safety data, now we're a year out. Effectiveness data, we're almost a year out, and at least for the Pfizer vaccine, and the others are following. That the combination of those two things will allow full approval. Does that really make a difference in our practice? The answer is no, it doesn't. Because the literature, the effectiveness data is already published. Most of the time, producers of vaccines and medications won't publish their data until they go get FDA approval, right? Until they show the data to the FDA and the FDA says, yes, great, move forward. In this case, the science side of it, the effectiveness data is being put out on a weekly, monthly basis for everybody. The transparency is incredible at this phase of the game in this circumstance, and that gives us week-to-week knowledge of effectiveness of these vaccines. So I don't think the switch from emergency use to full approval will make a big difference for many people. It will empower or allow businesses, especially hospitals, to then set mandates for vaccination in the right setting, which is important because it adds some other legal protections for those businesses. But in point of fact, as a society, I think that distinction is minor.
As far as timing, do we know what the timing is, how much
Right. So the Pfizer has already asked for full authorization, and the FDA is reviewing with those criteria now. That may happen in the next few months. I've gotten a lot of questions about when will vaccines be available for younger children, younger than age 12. And the 5 to 11-year-old cohort is fully enrolled. They all got vaccinated in June, and we're now in that sort of 2-month safety and effectiveness follow-up period. And then younger kids, 6 months to 5 years of age, that study is ongoing and enrolling subjects worldwide.
A lot of what we're seeing in national news, we're talking about breakthrough infections with the vaccine. Can you address that?
Yeah. So the question is about breakthrough infections and what are we seeing? And breakthrough infections basically is the idea that someone has received the vaccine, but yet they still get infected and get sick from COVID. We are seeing breakthrough infections. We knew that would happen, right? There is no perfect vaccine in terms of effectiveness or safety. We absolutely know those things. And so we are seeing breakthrough infections. Those infections tend to be very mild. That is, it might just be a stuffy nose, feeling like you have allergies flaring up or something like that. Those patients are tending not to have fever, not to have the loss of taste or smell that you see with kind of the full-blown infection with folks who aren't vaccinated. Those infections are mild. A very, very few people who have breakthrough infections require hospitalization or are considered serious disease. The expected rate of breakthrough is 5-6% based on the clinical trial data. And so, again, we're not seeing anything at this point unexpected about those breakthroughs. But one of the key things we know, and as Dr. White said, people are showing symptoms with this Delta variant more quickly. With the original strain, 4 to 6 days was our incubation period. With the Delta variant, we're talking about 3 to 4 days incubation period. So that incubation period is shortened. And we also know, just data published just a few days ago, that the amount of virus that is being produced in your nose, if you're infected with the Delta variant, is about 1,000 times higher than the original strains of the Wuhan virus. So what that means is if the virus is replicating in your nose, there's a lot more of it there. That means when you're coughing and sneezing, you're putting a lot more of it out in the environment, and that's a major part of why this Delta variant is more transmissible. Because when you got a lot more virus, you're shedding it and spreading it.
Right now, Delta is the latest variant of concern.
Right, Delta is right now represents over 80% of the new infections we're seeing, and 98% of those are in people who are not vaccinated.
Any other?
About 93% of people who are sick are unvaccinated. So, and then about 99.1% of people hospitalized are unvaccinated.
Okay, so I think in the interest of time, we're going to go ahead and wrap it up now. However, I know all the panelists are going to be available for other questions after this. And also, please don't forget to leave, or rather, forget to get a handout before you leave with the testing sites and the vaccine sites that are coming up in the community. Thank you very much.